Hello there. Welcome back to another Eye Care for Your Brain with board certified neuropsychologist Dr. Karen Sullivan. We are here for brain health, education, and empowerment you can trust so you can be your own best brain health advocate. Tonight is going to be the last time I am using my iPhone for these lectures. We have done the Eye Care for Your Brain free brain health lectures every week just about for 5 years, and every single one has been recorded on my iPhone. And after much discussion, we have decided we are ready for some upgrades in our technology. So be prepared to see me looking even better and to see and understand the lecture on an even more deep level so it helps you. Tonight, our topic is the science of adult ADD and ADHD, attention deficit disorder and attention deficit hyperactivity disorder. These are two sister neurodevelopmental differences. I don't like to say that word disorder. Try not to use it when I don't have to. So this is something that starts in childhood, typically between ages 5 and 7, all the way up to ages 12. And about maybe 5% of the US population has one of these attention issues. And they often last into adulthood. So what we think is that probably between 15 and 65% of people still have lingering symptoms in adulthood. Now that's a very big, wide statistic, right? 15 to 65, my goodness. So we still are not doing a great job of diagnosing the right people at the right time with the right set of issues. So what you're going to learn tonight is that ADD almost never walks alone. There are a lot of companions that come along with this attention difficulty. And what I'm going to try to share with you tonight is when I review the literature on this topic, what is it that stands out to me? What is it that I would want to know? What is it that doesn't get a lot of talk in the common media pieces about ADD? After being a neuropsychologist independently now for 10 years, I see these patients often. They're actually some of my very favorite patients to evaluate because the adult presentation can be so misunderstood. So we have thought about this condition since the 1930s. Back then it was called a hyperkinetic syndrome. And now, as we know with so many brain health challenges, we know that we don't want to rely on these cut and dry checklists of symptoms. We have to be person oriented. We have to respect that multiple issues come together to create brain health challenges and that all of us respond differently to them. So the pursuit of understanding the brain is very personal. This is why we advocate for neuropsychologists to be a part of your care so much, is because many of these things that I'm going to say, yes, they're universally true, but there's a lot of variability in the way people experience and express all sorts of brain health things, including ADD. So at the heart of these two very similar syndromes is really differences in two basic brain health systems: arousal and motivation. Those are the basic two areas where these people struggle. So they oftentimes very much struggle with sustaining attention in the context of low engagement or low interest. So this is not a broad attention problem. This isn't that I can never pay attention. This is that my attention is driven by my interests. And if I perceive that it's not interesting or it's not valuable, or God forbid, I'm going to be bored, these people don't have nearly as much conscious control around directing and sustaining their attention. So that is really different than someone without ADD who can basically say, I'm not interested in this lecture, but I know this is good for me. I'm going to be tested on it later, and so I'm going to pay attention. People with ADD don't have that privilege. They don't often have access to that ability to override their innate, deep-seated push to get focus and take it somewhere else, okay? We also know that these people really struggle with distractibility, right? That's where the kind of joke about the squirrel and the shiny object come in, is that a lot of different things kind of ping in their attention span, and it's really hard for them to stay focused. But one of the biggest problems with attention deficit disorder is the name. It is not just an attention problem. It is very often also a emotional control problem and an executive function problem. And these two things are the exact two things that change as people get older. So I'm convinced that part of the challenge in having this is that when you even go to read about it and you read the symptoms, it's like, is that really capturing all of me? Is that really all that this is? Because we don't do a good enough job kind of publicizing the other parts of this. So these challenges are present for people in all settings, at school, at work, interpersonally. ADD makes it really hard to be consistent, dependable, and engage with people in the same way that people without ADD seem to be able to do without much effort at all. So I've been throwing around ADD and ADHD. What is the difference? The difference is the H. The H is hyperactive, right? So both of these folks have trouble with the sustaining attention, the trouble with distractibility. But on top of it, people who have hyperactivity are going to struggle with things like fidgeting, hyper-talkativeness, physical restlessness, hating sitting still, tapping their foot, twirling their hair, okay? Like I said before, these are neurodevelopmental differences, which mean they have been there since the dawn of time for that person. And we know that there are both structural and chemical differences in these brains, but it's a chicken or an egg question. What we're not quite sure of is which one came first. So neuroimaging tells us that there are structural differences in the frontal lobes of people who have ADD and ADHD, and that this is probably responsible for the trouble with attention, deciding and sticking with the same decision over time, and some of those emotional issues. But we also know that chemically, dopamine and norepinephrine are huge influencers in the ADD brain. We also have recently learned in the last maybe 5 to 10 years that impaired glucose metabolism is absolutely part of ADD. It's seen in a general decrease in the whole brain and further reduction in those prefrontal cortex areas. ADD, the attention piece, that is the core piece, that is the foundation that ties these people together. But like I said, oftentimes there's the hyperactivity on it. And what you're going to learn tonight is how many more things are so incredibly common that go along with it, that even if you've been diagnosed with ADD and you're not getting full symptom relief from your medication or any therapy that you've done, chances are you could have something else that's also hanging around. And until you label it, you're not going to get treated for it. So this is part of the philosophy we have in neuropsychology, is that you have to get a proper diagnosis to get to the point of proper treatment. So there's 3 subtypes within ADD. So we have the inattentive distractible type. So this is mostly the inattention, the high distractibility, but there's no hyperactivity. Then we have the impulsive hyperactive one. This is actually the least common. And this is when people, have no filter, put their foot in the mouth, do reckless things, and they're very, very hyperactive, but they don't have as much of the inattention or the distractibility. But the most common type is combined. So it's actually when people have features of both inattention and hyperactivity. That is absolutely the most common. So why do I love evaluating for ADD? It is because when it is diagnosed properly, and I do see benefits on both sides. Some people come to me and they really kind of think it's ADD, or they maybe even want it to be, and we find out, no, it's actually this other thing. There is relief in that because, again, once you have the diagnosis, you can proceed with proper treatment. But when someone actually has it and I am able to explain what it is, it has this incredible transformative effect on people. So what I often see is that people are released from deep shame and guilt, and it is very powerful. So to quote from probably the most famous book on ADD, people often respond by saying things like, "You mean I'm not lazy, crazy, or stupid?" Because when everything that your brain tries to do is difficult and your environment tells you the way you learn, the way you process things is different, we internalize that. We very often have self-esteem and identity issues that come from being different in the brain health arena. So as everything we talk about here at I Care for Your Brain, the more you know, the better you're going to do, the more you can advocate for yourself. So I think we're pretty clear on those core symptoms, but before we get to the bulk of the lecture, I do want to go through some other common symptoms. So that way, if you have it, you can be validated. If you're wondering if you have it, you can try these symptoms on for size. So one of the first things is trouble with time estimation. People with ADD are the worst at estimating how much time it's going to get. So this is why they're always late, right? So it's only going to take me 5 minutes to get to work when it's clearly a 10-minute drive, or I can get in and out of the shower in 5 minutes and I'll be ready, right? I know I can get my coffee, get my keys, get my laptop and meet you in the car in 30 seconds when it would take anyone 3 minutes, right? So these folks oftentimes are kind of surrounded by perpetual stress and chaos because there's always this feeling of like being behind the 8 ball, never being organized, never having it together. So constantly underestimating how much time things is going to take often winds up hurting relationships because people then interpret like you can't be dependable, and that's really hard. Closely tied to poor time management is procrastination. So this is understood as kind of a failure of self-regulation. So again, whenever it feels like it's something about us that's not quite right, we feel guilty, we can have a negative mood, we can have that chronic stress. But what we know is that when you are kind of living in chaos and always doing things right up to the deadline, it's really hard to feel stable when the basics of your day are kind of always in flux. It is kind of unnatural to these people a lot of times to have a routine, to have structure, and in fact, they hate it. So one of the things that I thought was most interesting in my research for this talk was how strong the dislike is for people with ADD for boredom. So even the concept of being bored is like, to a person with ADD. So that idea of, I don't want to do the mundane tasks of everyday life. I would be I'm much more reinforced by giving in to the immediate temptation. So even something like showering for people with ADD can be so difficult because there's so many steps. It's kind of routine. So it gets the label of being kind of boring. But then what I find is once people get in there, time goes by and they're in there until the hot water shuts off because there's so many interesting things and they're so getting such kind of a positive dopamine rush from being in there. The other one is trouble making decisions. This can be agonizing for the person with ADD and probably has something to do with dopamine and those prefrontal cortex changes that we were talking about. Oftentimes people with ADD talk about like a pinging, feeling like every single thing pulls their attention. It's almost irresistible to not look at something. And part of that is that kind of self-soothing of trying to regulate your dopamine. So dopamine makes us feel good. It's activated with novelty, with newness. And because people with ADD don't have as much control over their dopamine, they get good feelings by newness, by things that are maybe a little bit more risky than the person with ADD might see those things as kind of, they might be more risk averse, whereas the person with ADD is kind of like, ooh, this is interesting. Folks with ADD are phenomenal at hyper focusing. If you are someone in this community, let us know, what rabbit holes you can go down on. People who they are interested in something, they can work hours and hours and hours a day. That's why it's so key to figure out your passion when you have ADD so you can pursue it and not get stuck in a 9-to-5 office job that's going to make you feel tortured. People with ADD often have a certain amount of irritability, which I would recategorize as poor frustration tolerance. And what I mean by that is when they get interrupted, oh my God, it takes enormous energy for these people to put the brakes on and transition to something else. And if you interrupt the hyper focus, you're definitely going to pay the price. The other two are very, very common. Trouble with sleep, but this doesn't often get talked about. So beginning around puberty, people with ADD are much more likely to experiencing shorter sleep cycles, problem falling asleep, trouble staying asleep, and actually being diagnosed with a sleep disorder in adulthood. The final thing is never feeling like you live up to your potential. This is probably where a lot of the heartbreak comes along with living with ADD, is this disconnect between what you know you're capable of and what you seem to be able to manage to produce. It's like a 6-lane highway has to be shortened down into a one-way street. I think that's kind of a good metaphor. And I think it really wears on people. It's not just, oh, it's hard for you to pay attention. It's like, no, I feel like crap a lot about myself. I always feel like I'm not getting it. I don't seem to have my stuff together. So it's as psychological as it is neuro. There's no doubt about it. So the diagnosis is very complicated, and I'm actually not going to go into that too much because what we're going to talk about later is stimulants. And there are a lot of people, unfortunately, that look online to figure out how to test positive for ADD so they can get stimulants. I don't think that's any of you nice people, but what I will tell you is that one of my most helpful questions that I ask people is, if I could peer into your 4th grade classroom and I could see you there at your desk, what would I see? What would be observable to me? And then the second part of my question is, what would I not see? What was going on for you internally at that age? What was going on at home? So this can oftentimes help us tease apart the inattention, the hyperactivity, the trouble with focusing, the trouble with being reckless, but it also gets into some other circumstances that may make a kid look and act like they have an attention problem, like trauma in the home, drug abuse in the home, being hungry at their desk, right? There's a lot of other things, we're going to talk about that in a minute, that mimic ADD. So if the answer in my clinical interview suggests ADD, then we do some different screening instruments. Some people don't feel like neuropsych testing is as helpful because the neuropsych testing environment creates certain conditions that people with ADD do very well in. So our tests tend to be relatively short, right? We go around and do a bunch of different things. So there's a lot of novelty. There's not a lot of open-ended things in the way we do neuropsychology right now. So a lot of times we're really relying on people's self-report. We do want to make sure their expressions of their symptoms are valid. So we sometimes look at that, but it's not the most helpful thing for neuropsych actual testing. And then of course, we think about what is the impact of this difference on someone? What is the functional impact? How is their quality of life? This is the difference between going to a neuropsychologist and maybe a primary care doctor, or maybe even a neurologist, maybe even a psychiatrist, is that we are really good about getting the big whole person picture. We want to know how this affects your social life, your relationships, the impact on your self-esteem. And then of course, we're always moving into personalized recommendations. So what works for one person with ADD may not be the thing that works for the next person. And when you are done with my lecture tonight, what you're going to realize is just how complicated it is to treat this condition. And this is why so many people are actually undertreated and really struggling with ADD. So what I have done is I put together a top 10 list of things related to ADD, ADHD that I want you to know so you can understand yourself or understand someone you love that has this condition, okay? My first thing I want you to know is just because you are struggling with attention or getting things done, this doesn't mean you have attention deficit disorder or attention deficit hyperactivity disorder. Many things cause us to struggle with sustaining attention, staying focused, being unable to concentrate. This is a small list of those other things. Anxiety, sleep problems, too much caffeine, stress, trauma, hearing or vision problems, learning differences, learning disabilities, substance abuse, chronic pain, medications. Many things cause attention symptoms that are not necessarily an not necessarily an attention disorder, okay? So one of the main things that you have to think about is that age of onset. So if you started to struggle in adulthood with paying attention, it really can't be ADD because remember, it's neurodevelopmental. Developmental means it's been there since the beginning of time. So there's many reasons that so many things mimic an attention disorder. And part of it is because it does involve so many parts of the brain, and it does involve things like dopamine. dopamine, which does many, many, many different things in the brain, not just help us focus. So I have definitely found that I would say about half the people who come to see me who are convinced they have ADD don't really have it. And oftentimes these people have actually been diagnosed with it before. So why is this? Well, part of it is just how common attention problems are. But hands down, the number one complaint of people I see under 50 years old is that they can't stay focused. Some medical providers, not so much now, but there was a time 20, 30 years ago where everybody had ADD. There was just this stamp that seemed to be going around. So some doctors are very free to give the diagnosis and don't really understand the neurodevelopment of ADD, and so they misdiagnose people. Many people are self-diagnosed, again, thinking that any problem with attention is going to be related to ADD. And the main way, again, to think about this is that age of onset. And it really matters to get a proper diagnosis one more time, because why? You're not going to get personalized care without it. Number two, that many people don't understand is that symptoms of ADD, ADHD change in adulthood, okay? So adult symptoms start to become diverse, more different. So kids with ADD look more similar than adults with ADD, okay? So the two things that change when we get over 18 are that we have more of these executive control issues. And what I mean by that is trouble with organization and procrastination. And they're also having more trouble with emotional control, especially if you had physical hyperactivity as a child. What it seems like happens is when we get into adulthood, those symptoms transition into internal restlessness. So you go from your body being very hyperstimulated to your mind being very hyperstimulated. A few reasons that this happens, that why do symptoms become, worse with age? When I start to see people in their 60s and 70s, now they have normal aging on top of a long-standing attention disorder. So it kind of gets a little bit exacerbated. So when symptoms of ADD change, it often takes people by surprise and really stresses them out, because we don't talk about this enough. You're not going to open a book and basically see, trouble with, what your unique learning style is. You're going to think about focus, right? It's an attention disorder, so that should be my only problem. So what a lot of very smart people do is they learn their ADD young. They understand, what do I need to do to focus best? Well, yeah, it might not be your cup of tea, but I need music. I need to work under intense deadlines. I know myself. I'm not going to get it done till the 11th hour. I need to work in chunks and then I reward myself. I need to be in a library because I have to be focused and not have the TV on. That's the easier part of the ADD. The organizational piece is the part that gets harder. And again, you don't have coping skills for it because you've used up a lot of your ADD coping skills with focusing on the attention piece, okay? The other thing with older age is that there's also this idea that maybe that baseline glucose metabolic difference gets worse with age, because that's one of the aspects of aging, is that our brain doesn't take up glucose as much. So maybe is that part of it, because our brain needs a steady supply of glucose in order to be able to function. So I think it's stressful when we don't really call brain health conditions by exactly what they are. So perfect example is benign essential tremor, right? Nothing benign about it as far as I know, but boy, quick way to invalidate a group of people. So the impact of living this way with ADD, again, I think it's very intense, and people without ADD probably can't really understand how much it impacts people's identity. People don't often sit back and think, wow, I think I have a neurodevelopmental difference. In the face of no answers, in the absence of a better explanation, people blame themselves, right? It becomes a character flaw. It's laziness, it's lack of effort, which is really devastating to self-esteem over time. So remember, this is not a disorder that has anything to do with laziness or willpower. Number 3 is, man, does ADD make school and work stressful. So when you have ADD, you not always, but oftentimes need some type of extra support in school. They have higher rates of dropping out of school. Multiple colleges is classic. It's really like a square peg trying to fit into a round hole. It's not that again, getting away from this term disorder, it's just a difference, right? If the Western school system operated in a more novel way and didn't require students to sit still 8 to 9 hours a day, people with ADD wouldn't suffer so much. So it's not all on the person, it's also a mismatch with the socialized system of school, right? So sitting still, being quiet, being focused and organized, tolerating boredom, that's basically being in school until you get into college and you can have more control. But we're basically asking people with ADD to often really focus on their Achilles heel and do the very things that they're gonna struggle with all day long for 13 years just to get a high school diploma. Several studies have shown us that the big thing that really predicts school function with ADD is the inattention. Hyperactivity isn't so much of a problem. It's the daydreaming and the drifting away that winds up hurting people. Number 4 is just how many issues, I said this before, come along with ADD. So this means once you have ADD, chances are you're actually going to have something else. And this is very important to know. 80% of people with ADD actually have a coexisting mental health or substance abuse issue. Now, again, we have a chicken or an egg phenomenon, right? Why is this happening? Probably it's because they all stem from pretty similar neurobiology. Norepinephrine, dopamine, these things are very common in the brain and help movement to cognition to mood. So the most frequent comorbid issues are mood and anxiety disorders. So we have major depression, generalized anxiety, and bipolar. So studies have concluded that there is an emotional control issue with ADD. I was mentioning that before. And what that means is when your emotions come on, they can be stronger and you can have a harder time inhibiting them. It's harder to put the brakes on what comes out of your mouth when you have ADD. This is a fact, right? So some of it is that the core symptoms of ADD could be being misunderstood as mood disorders, or we could really be looking at when you have one, it's like one side of the coin, you kind of have the other side too. So let me just give you some statistics on bipolar. So if you have ADD, this is without the H, 9 to 21% of people will have bipolar, and this goes up to 47% when you have that H. It is unbelievable. It's much more common to have bipolar 1 than it is bipolar 2. And the big distinction there is the extent of the mania. So the highs and the lows are worse with 1, and you have these actual manic episodes. Bipolar 2 is more like moodiness, but more chronic irritability, a little bit of mania, but nothing that really boils over the top. Several studies have suggested that having ADHD brings on bipolar 1 earlier. Okay, so that's something to keep in mind. People who have ADHD are between 19 and 53% more likely to have major depressive disorder. I think that's really difficult. If you think of both of those clinical challenges create issues that reduce motivation, that's an extreme double hit. If you have ADD and you're depressed, oh my gosh, how will you ever get up and get things done? That must be incredibly painful. About 30% of people who were sent to a depression clinic when they were properly tested wound up testing positive for undetected ADHD. Then we've got this generalized anxiety disorder. So rates are approaching about 50% of people with both ADD and ADHD actually have generalized anxiety disorder. So more than 4 times more likely to have a clinical anxiety disorder. And within anxiety disorder, social phobia is actually the most common. So these are when social interactions cause irrational anxiety. These people worry a lot about being embarrassed, people seeing their red cheeks, being humiliated. And again, here we've kind of got this double hit hypothesis, right? So ADD is going to probably make you feel kind of weird and different when you don't know better. But then we have a social anxiety disorder that's going to make you feel weird and different. So the double hit hypothesis, I think, is really important for developing empathy towards people with ADD who are even struggling more. So can't you see how this just leads to underrecognition, overdiagnosis, and underdiagnosis? I think that's really scary. So it's complicated, and this is what leads a lot of people to have a delay in treatment. ADHD symptoms can also be masked by substance use. You're more than twice as likely to have substance use or dependence. And the way I often see this is that substances become a form of self-medicating. So many people who have ADD smoke cigarettes because nicotine is such a focuser. It's incredible how it makes people with ADD be able to actually zone in. This is why we also see cocaine abuse, methamphetamine abuse, but even things like energy drinks. Honestly, I often ask people in my evaluations, what is your relationship to caffeine? And if someone tells me, you know, I'm taking like 6 to 8 cups of coffee a day, it's like, wow, okay, that's not normal. You're probably doing that to self-medicate. But we also see other things like alcohol coming in to calm people with attention issues, because you can only be keyed up for so long before you actually need something to bring your nervous system down so you can relax or sleep. Like I said, you're about twice as likely to have a substance use issue. And oftentimes, if you ask people why are they taking something, they will say it's to not be as anxious, or they'll say I need it to go to sleep. So they might not even be aware that there is evidence to suggest that cigarettes, nicotine do make you focus better. I mean, it's not good for you, but it's a fact. So sometimes people don't even know why it is they're gravitating towards certain substances. One of the things that I've heard is, well, of course, if you give these kids stimulants, right, the drugs that really help ADD at a young age, aren't you basically encouraging them to go into a life of substance abuse? And it's actually the opposite. So there's evidence that the use of stimulants in children reduces substance use and abuse in adolescence and adulthood by up to 85%. So what we see is that it's actually not treating people that becomes the problem. Okay, number 5 is the financial burden. ADD gives people issues with being able to sustain employment oftentimes. 42% less likely to be employed full-time over the course of 2 years when you have attention deficit hyperactivity disorder. You make on average $15,000 a year less. I thought that was pretty interesting. Higher instances of getting a traffic violation. There was a study in Japan that showed ADHD adults visited physicians 10 times more often, and higher rates of emergency room visits and hospitalizations at 3 times the greater amount. So some of that is the sensation-seeking behaviors that can go along. Number 6 is that, yes, ADD is different in women. A systematic review came out 2 months ago, September 2022. We had a study called Gender-Based Differences in Prevalence and Effects of ADHD in Adults. So the model we all work from in ADHD is basically based on a young boy's experience of ADD. And what that is very hyperactive. They can be disruptive. They're hard to ignore. But guess what? That's not how females' ADD expresses itself. We are much more likely to go internal. The boys are doing the externalizing often. The girls are doing the internalizing, right? So we are drifting off. If we do have impulsivity, we are getting labeled, if we interrupt or we're blurting things out or we're talkative, we're labeled as chatty Cathy, or, we have emotional issues. It basically gets explained away as a social problem as opposed to an attention issue. So we have way more women that get diagnosed in adulthood. So we fly under the radar oftentimes until we get to the point where it's like, why is life so hard? Tired of struggling. I'm tired of wondering why it is I have to work so hard to do what other people seem to do so easy. Oftentimes, because it's so important for girls historically to fit in socially, what we see in the research is that a lot of girls spend a lot of time trying to avoid those negative social labels, so that they don't want to be the one who takes attention away from people. They don't want to be, there's kind of an emotional, kind of almost like a shyness, which kind of makes the girls just go a little bit more kind of dark and deep with their symptoms. I think the girls seem to, in research, spend a lot of time hiding. Number 7 is that ADD is very largely genetic. About 76% of the variance in ADD goes back to family history, and the rest is lifestyle. So there's 2 things that really stand out. Lack of sleep is very commonly associated, and a lot of time watching television. So those are the 2 biggies that get supported in the research, but there were a couple other ones that had modest influences that I wanted to share with you because I think they're really interesting. And if you have kids or grandkids, it's good to know these things. So less than 3 cups of water a day is statistically associated with having ADD. Artificially sweetened juice drinks. So interestingly, sugar has not been related to ADHD, but artificial sweeteners have. Less likely to read for an hour a day, more than 2 hours of screen time, and reduced physical activity. That's kind of the perfect storm that comes together in kids who wind up getting labeled as having ADD. Number 8, I kind of said this to you before, but it's about how undertreated folks are. So more than 80% of the youth under 18 are not treated with medication, and only 11% of people who have ADHD actually take a stimulant. Stimulants are very effective at improving all the symptoms of ADHD. So the attention, even some help with the organization, can help with emotional control. And what is the treatment? So treatment is not just medication, even though that really is a big part of it. It's really a multimodal approach that includes social support, psychotherapy, cognitive rehabilitation, and a focus on self-care that emphasizes sleep, exercise, and nutrition. So stimulants are like Adderall, Ritalin, and they improve alertness and focus for anyone, right? I sometimes joke with my patients, like my cat would benefit from taking Adderall. But for people with ADD, it's not like that. It's really kind of amazing what happens to them. So they actually feel normal. They don't feel speedy. They're not doing this to get high. They slow down. It helps them stay on task. It's basically been described as glasses for the ADD brain. So before, everything's kind of out of focus, and the stimulants just bring things into focus so people can wrap their head around what they need to do. Stimulants work by increasing certain chemicals in the brain. So again, you've heard it before: dopamine, norepinephrine, and most recently, glucose. What we now know is it's not just that these medicines improve alertness. It also increases cognitive motivation by targeting a part of the brain called the striatum, which is very important for motivation and action. So that's incredible that that's part of it, right? Because that's what people internalize is the lazy, right? Why am I not motivated? But what these studies tell us is that's a hardwired thing that can be improved with medication, and then you're not going to have to suffer with those self-esteem issues. So there's randomized double placebo-controlled trials that provide a lot of solid evidence that stimulants are incredibly effective in most people. They're unique medications because they're what we call quick on, quick off. That means they don't take weeks to work. You can get a prescription, decide to take it Monday through Friday, and take the weekend off. In fact, that's actually recommended because one of the issues with stimulants is that they can reduce in effectiveness over time if you take them every day. So we want people to get early treatment. If you have a grandchild or a kid that you think is maybe struggling with this, please encourage the parents to go see a neuropsychologist. When we track kids over time who have ADD, but it's not addressed, it's not diagnosed, it's not treated, what we find is that these kids have a much higher risk of all those things I talked about before: depression, anxiety, substance abuse, being unemployed, not finishing college, not making money. The risk of developing cigarette smoking over the course of 5 years is like doubled. It's a lot of suffering that doesn't necessarily need to happen. Now, that being said, it's also never too late. So if you are 80 years old and listening to me and you say, oh my God, this is it, this is how I felt my whole life, please, please, please look up your local neuropsychologist and go have an evaluation with them. Medicare covers an annual visit to see us, and you will have to wonder no more because you'll have expert assistance in figuring it out. The most common side effects of stimulants are anxiety, loss of appetite. But what we find is that most people say these are mild and that the benefits outweigh the risk. Now, are there negative effects of stimulants? Of course. They are very powerful medications. They can have negative consequences when abused. Short-acting stimulants are abused more often than the extended release. Adderall is probably one of the most abused drugs in the country right now. But just like we're starting to talk about with people with chronic pain, just because some people abuse it, don't mean we're going to withhold it from people that need it for a medical difference. Okay. I know some of you asked me about the long-term effects. They've actually just started to come out with this data because stimulants haven't really been around that long. And what they're finding, this is in animal models and adults, is what I said before. They don't commonly work as well over time. People feel like they wear off a little bit more. The only thing we see is over age 65, we do see it does increase heart rate a little bit and blood pressure a little bit. It is a stimulant after all. It's a physiological stimulant. So this does increase the odds of a cardiovascular event like a heart attack or stroke. But really what we're trying to look at is personalized risk factors. So don't take any information that I say to be a guidance for your medical care. You and your doctor have to talk about this together. I've seen 80-year-olds on stimulants for the first time, and it's life-changing. I've had patients with AFib, and their doctors are like, nope, we're not going to take the risk. So it really depends. One interesting thing about medications is when they studied people in one group over the course of 16 years, only 10% of people were still taking their stimulant at 16 years. And what they said was that they actually learned skills while they were on the medication of how to be more organized, that then they could just follow through with dedication and focus when they weren't on the pills. So this is a case of the pills teaching skills. So that's something to think about. It doesn't have to be that you're on these medications forever. You can get on them, do some cognitive rehabilitation where they teach you about external strategies like how to truly use alarms, notebooks, to-do lists. You can learn internal strategies, which is how to resist some of that temptation of pinging around, how to not give in to procrastination. Behavioral strategies work. That's my number 9 tip, is that get a right diagnosis, and then you can get yourself to treatment. Now, treatment is a lot easier to get when you're a kid than when you're an adult. When you're an adult, what you're typically going to find is that there's coaches that you have to pay, but a little bit of an investment can really go a long way. I also wanted to share with you some studies that gave people social support and reduced stigma. And these people had less ADD symptoms and felt a lot better self-esteem because the important people in their life, their spouses, their parents, their teachers, understood what it was. And they didn't make such a big deal out of it. It stopped being a disorder and it became a difference. And I think that that's a really helpful paradigm shift that we really need to change to really help this special community. And the 10th one is that lifestyle factors absolutely help. These brain health challenges with attention and organization will be less intense and less bothersome if you can get into routines and do things on a regular structured basis, the very things that you probably hate. We absolutely know that daily exercise and improved sleep are the 2 biggest things that you can do to help attention. What about nutrition? What about natural supplements? Well, the big thing is that you want to avoid anything that interferes with stable mental energy. Okay, so that glucose, right? Dopamine. We want to avoid blood sugar spikes. We don't want to eat the sugary food, the ultra processed stuff. We also want to think about one possible supplement, and this is one that I've just really recently been coming around to, and it is polyunsaturated omega-3 fatty acids. So the research says 1 to 2 grams a day in meta-analyses and randomized placebo-controlled trials had a significant improvement in people. So it helped them focus. They felt more organized. We also see some studies looking at melatonin and treating people with chronic insomnia because of attention issues. And there was some decent data there. There's no evidence that iron helps, zinc helps, magnesium, ginkgo, St. John's wort, none of the Be Focused, brain health focus supplements. I don't believe in any of that stuff. So in closing, the struggle is real. You know this if you are someone who lives with it. If you can listen to my words and work on restoring your wholeness and reducing stigma and stress that comes along with it, maybe even think about some of the personal strengths that you have from ADD, the positive outcomes, your high energy, maybe you're creative, you're determined, your ability to get easily interested and excited about new things, maybe you're adventurous, you're willing to take risks that other people aren't willing to take. I think that is really important. I also really believe in sharing as you're comfortable with your community. So if anything I've said to you resonates, or if you are comfortable sharing, how did you work with ADD? What works for you? How have you stuck to it? How did you learn to be consistent? Those are really some of the biggest challenges. The way you can let me know if this 45-minute brain health lecture was important, if it was needed, if it was valuable, is to subscribe to our YouTube channel, leave me a comment, and consider sharing this on your social media channel. Those things really help. Thank you all so much. I can't wait to see you next time with my new studio. This will be the last time I have any audio issues, so if there was any drag, I apologize. But if you're still here, thank you so much, and I can't wait to see you next time. Bye-bye.